So, first of all, my name is Tina Hurley, as she said, and I'm very, very humbled and honored to have the opportunity to speak to you today. And as Jen had mentioned, it's a little bit inopportune timing in relation to my life, and I'll go into why timing has been challenging, but how kind of serendipitous it is to give a conversation and topic about persevering and overcoming adversity when I'm really still in the thick of my processes with this whole situation. So 4 years ago, I had everything. I had a budding relationship with someone who I thought was the man of my dreams, with a marriage that was definitely going to result from it. I had a brewing, amazing professional career as a PA with one of my very special mentors that's in the audience today that I'm very honored could be here. I had financial security. I had life just by the horns. I was a significant, at the time not adapter, but significant athlete in CrossFit that was on track for regionals and just really getting into the groove of my physicality. And I had two legs. And I met my to-be husband at a pool in Las Vegas. I'd gone there on a whim, single girl. A friend called me and said, come over for the weekend. I have a friend that lives off Strip, and we'll just go downtown whenever we want, and we'll just figure it out as we go. I said, sure. So I booked my flight that night. That Thursday I flew out, and the next day I was in MGM Wet Republic's pool party. Never did anything like that. And all of a sudden this 6'7" person swims up to me and looks at me and goes, Tina, CrossFit New Hampshire? I immediately was concerned about my safety. Ooh, this is the kind of situation my mom warned me about. But the aesthetics were there, and I felt pretty comfortable. And it turned out I had met him at my CrossFit gym 3 months earlier, and remembered this sort of, socially awkward guy that was, handsome and charming, and we had a lovely evening. And I knew after that moment that he was the one for me. There was no question, there was no doubt. And I got back to New Hampshire, and it was fast track. We had met essentially 3 months earlier, gas mask jump roping in a CrossFit gym, and I felt sort of bad because once he moved in 3 months later, I sort of bait and switched because then I ended up not being able to walk. So as I started to progress in my CrossFit career, I very quickly recognized that barbell movements or body weight movements or anything where I was on the bars, I excelled at it as a former gymnast and someone that was very, very defined by my physicality. I grew up in competitive cheerleading and was very athletic and was a personal trainer, and ended up pursuing a degree in exercise physiology and had done that and training for quite a long time. And so I had a natural predisposition to being decent at the movements. And then what I recognized was any workout where there was, say, 12 kettlebell swings, 21 pull-ups, and then you go for a 200-meter jog, and you repeat that a couple of times, I'd tear off the bar, 40 seconds sooner than the last athlete. And then all of a sudden everybody would be passing me in a 200-meter run because my legs would seize up, my calves would cramp, left greater than right, and then my feet would go numb. And I'd have to stop and let everyone pass me, and I'd get back to the gym, and it took a long time for those symptoms to abate. And I made every excuse that I could for it, and I thought back in my history, when I was younger, as much as I was an athlete, I never pursued anything endurance-wise. I never really jogged a lot. Jogging for fun wasn't my jam. My legs would cramp up. I just attributed it to, I was a gymnast. I hit the floor wrong, my ankles pushed down, I have the wrong shoes, I'm dehydrated, I didn't eat enough bananas, whatever the thing is that you tell yourself to prevent your mind from going to that worst case scenario. And at the time I started to begin dabbling in medicine. I was working as a medical assistant, essentially, but with some opportunities that were beyond that because the physician that I worked for was a preceptor for a PA program. And I ended up recognizing pretty quickly that as I progressed in my CrossFit, gym and workouts, that what I was suffering from wasn't normal. It wasn't that I didn't need to, couldn't stretch. It wasn't that I hadn't prepared. It wasn't hydrated. It wasn't my shoes. There was something wrong. And so when I graduated with my PA degree, I began working in the hospital and learning more about vascular medicine and acute care medicine. And I had some friends that had this condition called exertional compartment syndrome, which is common in young athletes that have a lot of muscle tone. And so I went and had that evaluated at an outside facility, and they said, you have a calf sprain. Okay, well, I'm not sure sprain is the right word, but we can pursue that. Okay, so they sent me for an ultrasound, and they ruled out a blood clot, which I didn't have, and I advocated for an orthopedic consultation. And I went to an orthopedist, and they did compartment pressure testing, which is this kind of archaic procedure where they stick a bunch of needles in your legs down into the fascia, the 4 compartments of your lower leg, and then they have you run on a treadmill until you can't go anymore and your symptoms are so bad you just want to fall off. And then they stick the needles back in your leg and they tell you, yay or nay, your pressures are elevated. Your blood engorges the muscle, it exceeds the space in the fascia, and it self-asphyxiates. It cuts off the blood flow to itself, and that's what happens to create your symptoms. And we can just cut you from your knee to your ankle, and we can relieve the fascia, but only 35 to 45% of people actually get improved with this. And we're talking about doing this incision from your knee to your ankle in 3 different spots on your leg. And at this point, I could still walk, at work. I could still, do small functions that I wanted to do. And I felt that was, at that point I had no scars, and that was very aesthetically concerning for me. So as I got a job at Elliott Hospital, of course you're incentivized to go to the hospital that you work at for financial reasons for the insurance companies, and I had to start fresh. And over the period of that year and a half that I was waiting to get into the physicians at that new hospital, the symptoms had gotten so bad in my legs that I couldn't take my dog for a walk around just 1 block. Because at the end of the block, there was a slight incline, and I would have to stop every 10 or 15 minutes because my legs would just feel like I had cinder blocks. I was just dragging cinder blocks. And I remember thinking, there's something wrong. I don't have a calf strain. And I don't think it's just this compartment syndrome because I'm just walking. That shouldn't be enough to cause such significant symptoms. But what do I know, right? So I ended up going to a wonderful primary care physician through Elliott, and she could just sympathize. She didn't know the specialty stuff, the orthopedics, or what would have been the next course. And she sent me to the orthopedist through the hospital, and this doctor was awesome. And she said, we can do this fasciotomy, where they cut your fascia, and we can do a smaller incision and do a blind cut. So you'll have smaller incisions, and if it fails, it fails, and at least you won't have as big scars. And I'm like, that's kind of a good idea. And if it's going to make me feel better, then I'm willing to do it, because at this point, my life is quite impaired by it. And I said, my mother just had stents put in her arteries for atherosclerosis and plaque in her arteries. Could there be anything that's not orthopedic related that could be related to my symptoms? And she said, well, rare things, but peace of mind is really important, so why don't you consult with a vascular surgeon, and then when things are good, you can come back to me and we can proceed with this procedure. I'm like, okay. So I go to the physician who, of course they're all colleagues of mine because I work in the same hospital. And I go to him and he checks my pulses at rest and my feet, and they're bounding and beautiful. And then I squeeze my calves down and I push my feet really, far down, and he can't feel anything on either of my legs, no pulses. And he kind of furrows his brows, and he doesn't believe it. He pulls out his Doppler, the thing where you can hear blood flow, and he puts them on my legs when I'm just at rest, and you hear, perfect. And then as soon as I flex my calves and I push my toes down really hard, in any location below my knee there was nothing. And it was related to symptoms, and my legs started to hurt as I did it. And he kind of just did this sigh and rolled back, and he said, I think you have a zebra. And in medicine, we're, as PAs and residents and anyone that learns medicine, you're taught to think of the things that kill people first, and you want to make sure you rule those things out. It's very important. But common things are common because you see them often, and so your attendings will always tell you, think of horses if you hear hoofbeats. Don't think of the zebras, keep them in your mind, but first think of horses. So as soon as he rolled back and said you had a zebra, I knew I was going to be along for quite a ride. And at that point I was working in hospitalist medicine, and my relationship was progressing significantly with my significant other. We were moving towards buying a house, and we had a dog, and there was this parallel of this really tenuous medical course and this really lovely relationship that was budding. So the search began for getting the diagnosis confirmed through imaging studies and going to a slew of physicians all along the East Coast, because the condition is called popliteal artery entrapment syndrome. So through different testing, CT scans and angiography studies in provocative positions, dye tests where they actually go into your arteries and inject it into your arterial tree and take x-rays, when I would squeeze my calves, sure enough, 2 centimeters above the joint line over both of my knees, all of my arteries just pinched off. And this condition is a limb-threatening issue because over time, that impingement on your vessel creates thickening in the wall of the vessel as a compensatory mechanism that ends up blocking the artery, much like older folks who get atherosclerosis, but it's sort of just a different process. And so the idea is to intervene surgically as soon as possible to relieve the entrapment before the artery is in a position where it needs to be replaced, because it's sort of a slippery slope from that point moving forward. So after 6 to 8 months of just being terrified and in pain and having no answers and having no that guy to go to, I ended up going to this Leahy down in Burlington, because the head of their department had seen about 5 or 6 cases over his 33 years. And 4 out of 5 of those were traumatic cases where it was an acute trauma that caused them. So there's 6 types of this condition. The first 4 are anatomic, where there's an actual anatomic reason that the artery is being entrapped. You have a small piece of calf muscle that's laying over, you have some connective tissue that's laying over, there's something specific that you were made with that shouldn't be there, and they can go in and take it out and problem solved. And then the other 2 are the more rare forms of this rare condition, where it's a functional issue. It ends up that the neuromuscular recruitment to your lower extremity creates a functional and dynamic entrapment, which is very hard, as you can imagine, to replicate when you're intraoperative and you're sedated and you're under anesthesia and you're paralyzed and you can actually move your leg. So the surgeries began, the diagnosis was about 4 years ago, and the surgeries began about 6 months after that, and the first one was the first debulking procedure. They went through the back of my leg, and they opened it up, and they took a peek, and they saw that there was, in fact, a small area of calf that sort of spanned over the artery. They said, well, this might be it. Doesn't look like it's big enough to cause the issue, but we don't want to go any further if that's what it is. So they took it out, they stitched me back up, sent me on my way. 2 weeks later, I'm at the grocery store, I'm walking around, and it's the same symptoms. And you know when it's different, and you know when it's the same. And then it was the jumping through hoops, the having to convince that it was in fact the same, the reimplication of testing, and in fact it was entrapped on confirmatory testing. So they took me back again for a more extensive debulking, and this time they chose to, it was February 4th of 2014, they chose to do it in a prone position, face down, and they wanted to go through the back of my leg again and really open things up and dissect out as much of the tissue that they could and take out as much as they could to make it done. This is going to fix you. Every time I went in, this is going to fix you. And when they went in, they took out as much as they could, half of my calf, a bunch of additional structures. They did the fasciotomies where they actually cut through the fascial tissue. And when they went to go close, they did a Doppler right before they closed, and they recognized that my artery was too blocked to leave alone. That even if the debulking was successful, they had to replace the artery or my symptoms were going to be the same, because my artery wall had just been really abysmal. So unexpectedly and unfortunately unconsented, they had to turn a 3.5-hour procedure into a 7-hour procedure to take out my arm, get my arm draped and prepped, and harvest 7 centimeters of my arm vein to replace the artery in my leg in the same anatomic space as the entrapment. So I woke up from that procedure, and of course 7 hours on my face in one of the donut pillows. And I woke up from anesthesia, and many of you probably had surgeries. You kind of wake up and you start to get, you get your ground, and you're not really sure what's going on, and the medications make you happy. And within a number of minutes, I recognized that something was terribly wrong with my eye. And within minutes, it was so severe that I remember just screaming in the post-anesthesia care unit, and they rushed an ophthalmologist into PACU, and I ended up having a 60% corneal abrasion because my eye had been partially open during the large bulk of the procedure. So they put out that fire, and they took care of it, and gunked up my eye, and that pain subsided. And pretty shortly after that acute pain subsided, I remember brushing my chin, and I couldn't feel it. It was like I had just had my teeth worked on, that Lidocaine feeling? Novocaine feeling? And I looked at my husband, my boyfriend at the time, and I was like, is there something wrong with my chin? He's like, Tina, it's really swollen. You look like you have a Jay Leno chin. I don't think that's normal. And then my forehead started to swell, and within about a 12-hour period, pustules erupted on my chin and my forehead in a very dramatic pattern. I couldn't open my jaw more than a centimeter. And I've never had a migraine before, and I guess I really never had a true appreciation for what a migraine is. But they called it a traumatic migraine from having been on my face for so long. There was no repositioning that had happened, unfortunately. And when they do vascular surgeries, they tip you up so your legs are elevated. And so I was literally resting the weight of my body on my face for 7 hours. And so they ended up being, once they got infectious disease and neurology involved and all these different people involved and had me on a patient-controlled analgesic drip, they ended up finding out that these were necrotic facial pustules. My skin had died from the pressure over 7 hours. And the pain from those facial complications were so excessive, I couldn't feel my surgical pain at all. The pain was so severe that I was hitting the patient-controlled analgesic button so much, and the threshold wasn't appropriate for my size, that it ended up putting me in respiratory failure, and I coded the evening prior to my 30th birthday, 3 years ago. So I woke up in the intensive care unit, and within 2 days they had me pretty managed on a medication regimen. But as you can imagine, pretty traumatic. As part of the resuscitation, once they get you stabilized, they administer Narcan, and that makes you go from pain control to you feel everything. And then you get rushed to the ICU, and they have to strip you down and bathe you in an antimicrobial solution and swab you everywhere for different kinds of things, and very, very traumatic. And so I was discharged to go home, and within about 2 weeks of walking, I had earplugs in and a mask on my eyes because I was so photophobic and phonophobic, I couldn't function from the migraine perspective or eat because my jaw wouldn't open. And I remember thinking, this is all worth it if it fixed me. I can deal with this is temporary. And I was walking in the grocery store about a month later with my earplugs in and my sunglasses on, and it was the first time I'd been out of the house, and I was walking down the aisle, and I felt the same exact symptoms as I had felt before my surgery. And I knew it was the same. And so I just melted down. My boyfriend was there. I collapsed into his arms. We both were crying. It was just very disappointing because that was supposed to fix me, right? Expectations. So I went back to the same place, and I decided that I would pursue another surgery, the third and final process of debulking in the same institution, and they would keep me face up so that my face would continue to heal. Because I needed to get it done as soon as I could because I'd taken so much time off from work already. And so they went in the side of my leg that time, and they took out as much as they could, half of my lower leg, and sewed me back up and sent me on my way. And within 4 to 6 weeks after that recovery, my leg was the same. And the surgeon said, unfortunately, there's nothing more that I have to offer you. At this point, your artery is so down that we're going to have to bypass you. And the implications on that with a person that I was with and wanting to start a family were quite significant. Because the medications that they need to put you on when you have a bypass graft are things that you really shouldn't be conceiving on. And so we started to have this discussion about how our lives were going to change because of the leg. How much of my life plan is going to be taken away from because of my leg. So a few months later, he proposed to me that summer, and it was beautiful. The engagement was stunning. He put so much effort into it. And I remember thinking, how lucky am I to have this parallel of the most wonderful time of my life to the most horrible time of my life, and how empathetic am I to people in life that suffer these kinds of tragedies that don't have that same support. So I had such gratitude for having that as my safety net. So we ended up pursuing a femoral popliteal bypass using my vein in my leg in March of 2015. And that was going to fix me. That was the thing. And you're going to get, studies show that you get 10 to 15 years of patency, but you're a person that doesn't have any vasculopathic risk factors, so you might be able to ride for this, forever. I'm like, okay, well, that sounds good, let's do it. So they took out, all the vein in my leg, and most of the vein in my leg, and they bypassed it, and it's outside of the anatomic space this time. They superficialized it to the top of the vessel, and so how could it be entrapped when it's not in the area of entrapment? And about 4 or 5 weeks later, the symptoms were the same. And I had to prove it with testing because it was so inconceivable how I could still have refractory symptoms despite having done what was the procedure for this. So they started to discuss grand rounds, multi-center grand rounds with my case. They discussed the case with the researchers in Wisconsin that write the research on this stuff because it's so rare, to figure out how we were going to save the limb of this young person. And they said, we don't have any additional suggestions. It's just bypasses at this point. And the reason my bypass had failed is because I had another, unfortunately, significant complication of something called intimal hyperplasia, which is scar development inside of where they sew the arteries. When you're young, you have a robust reaction to surgeries because you have a healthy immune system, and it lays down scar tissue along the margins of the sutures, and it ends up occluding the vessels at the plug-in sites above and below. So about 4 weeks before my wedding, I had a follow-up ultrasound because I had pushed the entire summer, and I was like, I am not going back to a hospital, not having the surgery, I'm going to will it away. I've got a wedding to plan, I'm too busy doing DIYs, I got to paint vases, I got shit to do. And the ultrasound showed my graft was down, and if we didn't intervene immediately, it was a limb-threatening issue. So he said, I think it's just the top and the bottom of your graft, and so we're going to take some more vein and we're going to patch both sides, and the lumen of the rest of the vein should be wide open. I think it's a flow issue. Okay. So we went in, he took more vein, he patched the 2 areas, and then a day later, I remember the PA that was also my colleague came by and rounded and tried to check pulses and didn't find them. And they do a terrible job of hiding at bedside. You can tell. I was laying there, and I sort of omitted the fact that I actually had transitioned from hospital medicine to vascular surgery to be a better advocate for my mother and myself, and to know the referral systems and to learn the tests and to be my own professional. So I was also working in the field, and so I knew what was going on. And so, of course, he came in later that day after the ultrasound and said, your whole graft is down, I was wrong, we have to replace the entire thing. So this is 4 weeks before my wedding. He took all the remaining vein from my leg all the way up to my groin, and he bypassed the entire graft. And 2 days later, I was functional, I was controlled on oral medications, and my bridal shower was that Sunday. And I begged them to let me go home because I didn't want to miss my bridal shower. I didn't want this situation to rob me of any more time in my life. And I had the most beautiful white tulle skirt picked out. And my family, my friends had made the most amazing, venue, and I had family flying in from all over. And damn it, I want a good memory. I deserve a good memory, so I'm going to get there. I'm going to check out AMA if I have to. And so they let me go home, and that morning, I hadn't allowed myself a ton of self-pity along the way, right? You're in crisis and survival mode, head down, plowing forward. And that morning, I had stripped down, and I was getting ready to do my little sponge bath because I couldn't shower because I had a wound vacuum on, and I just looked down, and I looked at my beautiful white tulle skirt and my outfit and my high heels, and I just remember thinking, I can't believe I'm right here right now. I thought my whole life would be different. I should be somewhere else, right? I should have something else. My life should have been different. These things should have fixed me. And it was the first time I allowed myself that amount of self-pity and acceptance of what was going on, and I just doubled over with, I don't know that I've cried that hard ever, and I mean guttural sounds coming out as I was folded over this stool in my bathroom, and then I felt a pop in my leg. And I looked down, and the tubing filled rapidly with bright red fluid. And I recognized pretty immediately that I was hemorrhaging from my leg. And so my leg started to visibly distend. And of course, I'm naked in my bathroom. Why wouldn't you be when a crisis occurs? And so I throw myself on the ground because I'm aware of what's going to happen and how many liters you can hold of blood in your leg. And I'm yelling to my husband, and he comes in, and I'm like, you can lose 3 to 4 liters in your leg, and if I lose consciousness, this is what you have to do, and call 911, but make sure that my legs get up in a position of shock, and throw me a towel. And he grabs my stepfather, who's living at the house at the time, and my stepfather runs in, and he shows him how to kneel on my femoral artery, and he runs down and gets a tourniquet, and he tourniquets my leg, and EMS is called, and they get me to the hospital, and they rush me into surgery, and they fix the problem. This is 3 weeks before my wedding. So we laid in the bed with the professionals at bedside, and we thought, should we do this? Should we cancel? I might not be able to walk down the aisle. And we said, we have to do it. We're obligated financially. We're going to lose all this money, really. So we're going to do it. So 3 weeks later, with the help of some pharmacologic assistance, I was able to walk down the aisle and do a little dancing, which was helpful. So we got married on the 10th of October 2015. And it was great, right? Magical, beautiful situation. 6 weeks later, my leg was back to how it had always been. So they said we can do endovascular procedures where we go through your groin and we snake down and we can blow it up with a balloon, but it's only going to be short term, and we need to start talking about limb loss. And I was like, buy me some time, that's a lot to chew on. And so he ballooned it open. I could hardly walk into the facility when I went to have the test, and I could walk out of it like nothing, and I ended up going for a 3-mile walk that day. And it lasted for about 4 to 5 weeks, and it was amazing getting a chance to even just walk, appreciating the little things. And then it happened again. He ballooned it open again, and then we fell into the right surgeon's hands, and we decided that we were going to have an elective amputation because it was the way to regain some life. So we had a farewell party for my leg. At that point, I had never had a tattoo. I did this like big henna tattoo, wild and crazy. And it was a big fundraiser. My community came together, and they were able to fundraise some money for all my medical bills that were astronomical, and my leg prosthetic. And the community banding together, and the support from all my loved ones, and even just strangers, people that came out of the woodwork. But one of the things that I reflect back on and think, I want to be that for other people. Because just that support, those hugs, those kindness gestures, the smile when you're standing in a line at a store, all of those things amounted to something significant, because I really felt like a ghost of a person at the time. So to sort of speed things up, because I know we're crunched for time, I ended up having a follow-up because my leg didn't go well. The revision, I had significant complications from the surgery that needed a revision. And I had a big wound because I got delirious in the hospital after my amputation, and I fell on it, and it pulverized the tissue, and I had to scrape it clean in September as another surgery and apply a wound vac. And day after my 1-year wedding anniversary, he felt sick. He didn't want to go out for our anniversary. And we had been a little bit strange because I was blowing spit bubbles on pain medication, and he was working the night shift. The next day, I had gone down to my follow-up appointment in Connecticut, and I came back, and all of his stuff was gone. 3-4 house, 2 dogs, half a leg with a wound vac, and no husband. And I tried calling, and I tried texting, and I couldn't get anybody. And a couple of days later, I got a message that said, I'm really sorry, I can't do this anymore. And I begged, can we go to counseling? So he met me at the first counseling session, and she said, I need a verbal commitment that you guys both want to work on this. And I said, of course, I didn't recognize we were going to get here. This is crazy, we've been through trauma, we must be an adjustment disorder. Like, we are a fairy tale love. Of course, this isn't what this is not the way it ends. And she looked at him, and I'll never forget, he sat there very robotically, and he said, I agree with committing to this process for not the purpose of reconciliation, but for the purpose of an enhanced communication for a more amicable parting. And the counselor, who's supposed to be completely neutral, just and looked at me, and I'm just, falling. So, he left in October of last year, and I had a visceral response to it. I curled up in a ball, and I let the world crush me. Couldn't eat, couldn't sleep, couldn't move around because I couldn't eat and I couldn't sleep. And ended up going back to work part-time 2 weeks later because I had to get out of my house or I was just going to go crazy. And I got to work my first day, and the nurse said, how are you? It's the worst question you can ask someone when they're visibly not okay. How are you? Don't do it. So I was like, and then she's like, I'm going to shut your door and cancel your patients and just stay here in case there's a fire to put out, but just chill and get your shit together. So I applied for SSDI, or tried to, and then I emailed a CrossFit gym, and I said, my life is unraveling, my leg was removed, my husband just left me, and if I don't get community and physicality, I really don't know how I'm going to make this work. I had not been in a CrossFit gym for 3 years because the frustration of not being able to do what I used to do was overwhelming compared to what I got out of it. And so I lost a lot of my identity in not being able to do that, and was isolated. And they said, just get here. We don't care that you can't pay, just come to us. And I began re-identifying and getting back into adaptive exercises, and there was a wonderful woman that was an adaptive wheelchair athlete there that was so inspirational to me my first day. And I started to get my groove back, some confidence back. This abandoned, betrayed, disfigured, hollow shell of a human started to redefine those words. And I decided to get away for the holidays, on crutches, with half a leg, with a wound and a wound vac hanging off. I went to Hawaii, Portland, Idaho. I hiked the trails in the Road to Hana. I one-leg surfed. I drank tequila on New Year's Eve with the best of them. I just shook it out. Big birds, And I started to okay, I can do this. I'm validated, I can do this, I can get through this. And why I can get through this is because people love me. no matter what I do now moving forward, as long as I own what I have, I've been gifted a purpose. We all search our whole lives for what our purpose is. And someone's just wrapped one up for me with a beautiful bow and said, here, do what you want with it. Am I going to do that lay in bed thing? Am I going to do that curl up in a ball thing and neglect this opportunity? Or am I going to serve it by trying to live my life as fulfilling for myself as possible with a secondary effect of inspiring others, because if I can do it, someone else feels like maybe they can do it. I'm going to do that. So I started to train for CrossFit, big CrossFit competitions, was quite successful, had another surgery March 1st of this year when they had to revise my amputation again. Continued to compete in a 5-week workout series despite having the amputation the second week of it and placed second in the international division. And ended up going on through the summer and continuing to do the same. Needed to have another revision and found out in August, just a couple of months ago. And at the same time, I went and did a CrossFit competition online qualifier for Wadapalooza, which is this really great Miami international competition, and knew that I needed to get the surgery done by the winter, because a new surgeon was starting at my office in September, and I didn't want to burden the office by leaving again. And I found out 2 weeks before that date that she was supposed to start that they were rescinding the offer for her and they were going to be laying me off. So I had to rush my revision, rush my FMLA forms in, and I just had my surgery a month ago where they redid the whole thing, and it looks awesome. Everything is finally going really well, and I have this opportunity now to go in any direction that I want because I'm held down with nothing. So as somber of a story as it is, and as much as I sort of rambled and left out some significant portions, the message is that no matter what you go through, as long as your vision is larger than what your circumstance is, you will always succeed. And if you don't know the direction that you're going or the outcome of the direction that you're going, so long as you're taking steps or humps away from an area that you know is unhealthy or not good for you, you're going in the right direction. I've had a cold for the last 3 days, and my mind is completely foggy. And the fact I was able to just converse for that long is actually pretty amazing. I just down some alcohol. But in order to make sure that I relayed a message, I know this is supposed to be off the cuff, but I wanted to make sure that I was able to tell this to you. So if you don't mind, Jen, I'm just going to read really quickly and then I'll be done. In school, we're taught if a part of something is missing, it can never be whole. In our perfection-driven society, we're taught that being attractive is to be perfect or as close to perfect as possible. We're taught that handicapped and disabled are synonyms. We're taught that handicaps are to be regarded as weakness, and that to be handicapped refers to being in a position of disadvantage. As an amputee and someone that's suffered tremendous tragedies repeatedly for the past few years, I've learned that everything that I've been formerly taught about this has been a lie. Life is not defined by the circumstances that we face, but truly by how we face our circumstances. Trees grow stronger in stormy winds, and diamonds are made under pressure. The trials we endure introduce us to our courage. Courage isn't sailing through the times of unknown without fear. It's standing up in the face of adversity when fear arises and actively choosing to persevere. You see, your body can do anything, it's your mind you have to convince. You have to realize nothing makes us feel a certain way. We give in to those feelings. We decide what we make of each and every situation. We decide whether we break or we resist, whether we assent or we deteriorate. Our perceptions are the things that we are in complete control of. Situations by themselves cannot be good or bad. This is something, a judgment that we as humans make them to be. Shakespeare said, nothing ever good or bad, but thinking makes it so. There's a situation itself, and then there's a story that we tell ourselves about what it means. And that's often where we're wrong. It helped me in my dark times to set intentions. If you know not to which port you sail, then no wind is favorable. Choosing a path, as I've said, regardless of the outcome, allows you to move away from fear, pain, despair, and anxiety, and to hope, happiness, and success by the means of your own perspective, how you choose to perceive your life circumstances and what you choose to make of them. I choose to view my unfortunate circumstances as the reason I appreciate the fortunes around me, the wonderful people around me, the amazing opportunities that I've been afforded, my deeper understanding of life, and my heightened emotional maturity. I believe the power of will is measured by how much resistance, pain, and torture it endures, as to whether it knows how to turn these things to its advantage. I truly believe that only to the point when we expose ourselves repeatedly to annihilation is that which is indestructible found within us. We're programmed to have more faith in fear than certainty in love, and faith that the universe has our backs. We fight to maintain white-knuckle grip control over all aspects of our life, leading to undue stress, frustration, despair, and depression because it's an unattainable, never-ending set of tasks. We become the New Age Sisyphus, never able to get the boulder atop the mountain despite day in and day out struggle. By letting go of this control, stepping back with acceptance of our imperfection and ultimate lack of control, we allow the creative forces of love and positivity to work through us, and in doing so truly begin to live a rewarding, less congested, improved versions of ourselves. We start turning obstacles into opportunities, adversity into advantage, trials into triumphs. We start driving because of our struggles and not in spite of them. We accommodate and adapt, and we ultimately let that which impedes us empower us. Marcus Aurelius once said, "Choose not to be harmed, and you won't be harmed. Don't feel harmed, and you haven't been." We don't always know in the beginning why things are happening to us, but if we move forward, don't give up, believe in our dreams, the possibilities really are endless. Limits begin where your vision ends, and in order to succeed, you have to be a no-limits person. Most people have perfectly capable bodies, but unhealthy minds and limiting beliefs. When people ask me how I stay so positive despite losing a leg, I truly wonder how they can't be, despite having all of theirs. Every day is still a challenge for me. Right now, life is quite tenuous. My other leg's on the chopping block, and I'm not even sure if a left leg baloney amputation is what's needed. It might be above knee. But I've learned to adapt, and my new outlook is try me, not why me. I've gotten over self-pity, denial, and shock of my circumstances into acceptance, which is this blissful place where you just let things happen as they come with less kicking and screaming along the way, because you learn that none of that changes your course, it just makes you miserable in the interim. I've realized that lifting others up lifts me up. Projecting positivity makes me feel more positive. Remaining optimistic despite catastrophe always leads to unforeseen favorable outcomes. Owning my vulnerability makes me feel stronger. And believing that my circumstances are happening for me and not to me keeps my perspective in check and my hope for the future robust. Your vision has to be stronger than your circumstance. Your whys have to be strong enough that the hows figure themselves out. So my mess turned into a message. When things get hard, take it one day at a time, because life doesn't care about your plans. When one day at a time seems too much because you're overloaded, take it one moment at a time. When those moments are too tough, just focus on your breathing, and your breaths will turn into moments, and your moments will turn into days, and your days will pass, and you'll come out on the other side being much stronger for facing your adversity and suffering through it than from turning your back and hiding from it. Thank you for your attention. In closing, please join me in loving yourself, loving each other, dreaming big, and never giving up. Thank you.